there, it was time to have a look outside Christchurch and New Zealand, and I had my heart set on the Brompton Hospital in London. Heath said to me to make sure that it was still at the leading edge, because, as we know, hospitals spend a period, and countries, a period of time at the leading edge, and then they lose it and someone else takes over. It appeared that for physiotherapy, the Brompton was still at the leading edge, and I applied for a position there. I was told that I would be interviewed on arrival. The means of travel in those days was by sea, which meant a 5 to 6 week journey. And that in itself was an experience. I went with a school friend who was a school teacher, and we had this glossy brochure in advance of our travelling. But we were to find ourselves in a 6-berth cabin on sea deck, which was below sea level, all, of course, that we could afford. And we had no idea of what was night and what was day from the depths of the sea. We did learn to play bridge, but it was a rather strange existence. And the swimming pool, which had looked so beautiful in the brochure, turned out to, in reality, have a film of suntan oil on it, and it was not quite as pleasant as it had first appeared. We also had engine problems and had to bypass Acapulco, but eventually reached Southampton, where we spent a night before travelling on to London. And to a bed sit, it was by this stage the middle of January 1973, and very cold. And it took us a little while to get used to feeding the meter, to heat the room and to heat some water to wash ourselves. But that too was an experience. I was interviewed the following day at the Brompton Hospital, and that interview was a tour of the hospital with the superintendent physiotherapist, Miss Diana Gaskell. I remember being amazed at a whole hospital being cardiothoracic rather than just a ward. But there were obviously very exciting things taking place at that time, and physiotherapy research. We returned to Miss Gaskell's office for a chat. She offered me the locum post and said, "You know that every good physiotherapist does not use forced expiration." I hesitated for a moment, but nodded in agreement as I realised that as a junior physiotherapist, at an interview, if I was wanting a job, I would have to comply, and did. I was rather surprised because I knew that Diana Gaskell had met and knew Bunny and Heath Thompson, but was not, obviously at that stage, not in agreement with huffing and breathing control in the context of airway clearance. The job was to start a few days later. I was to go skiing, but in those days it was not something that one would try to negotiate. The skiing was cancelled, and I knew I could pick it up a year or two later, and that was what I did. I took the post, and it was a wonderful experience. It was just at the end of the era of the upper middle class English physiotherapist still in evidence at the postgraduate teaching hospitals. Most people would wear their pearls to work. I say most because it was an all-female staff at that stage. And I began to realise, but could never work out, what was the correct way to take your jersey off, your cashmere. I got away without ever working that out because as a colonial I was not expected to know. We were sort of classless. But the physiotherapist whom I met at a later date, whose locum I was covering, had been given leave of absence to complete curtains for her house. It was a completely different era. Now one would be fighting for leave of absence to go to a course or conference. Then it was possible to take for other purposes. When she returned, having completed her curtains, I was then without a job, but there was a junior post coming up and I was offered that. It was to take place the following month. So I then did a tour of England, Scotland and Wales on a bus in the rain, but enjoyed that too, and was able to include a cordon bleu course for a week. Friends had told me to not do the introductory one because one would just learn how to make gravy, but to try and pass myself off at the interview as a more experienced cook, which I managed to get away with, and did the more advanced course, which was fun. I then returned to the Brompton and had rotations on medicine, surgery and paediatrics. Huffing was being used in the surgical patients, but was certainly not allowed to be used in the medical wards. The Brompton had many people from abroad, especially in the private wards, many from the Middle East, and very few of them spoke English. Interestingly, a number of them had taught themselves how to huff their excess bronchial secretions if they had, for example, bronchiectasis. And I have to admit to not trying very hard to stop them. But it just added to my clinical experience that people who were non-medical had worked out the easiest way to clear their airways. Just before I came back to New Zealand, because I was on leave of absence from the Canterbury Hospital Board, there was nothing in writing, but they said there would be a job on my return, and I felt morally bound to return to honour that verbal contract. Just before I left, I was invited to take a staff meeting to demonstrate the Thompson techniques. I selected a patient with asthma because I was wanting to show that I would not increase airflow obstruction. So we began with conventional postural drainage, which was tipped, side-lying, tipped. Breathing control, thoracic expansion exercises, chest clapping, and coughing when secretions reached the upper airways. I asked the patient to then turn over to the other side, and we were going to do postural drainage using huffing combined with breathing control. The patient had one good plug of sputum, which of course was expectorated during conventional postural drainage on the first side, and nothing left to clear when we used breathing control and huffing on the other side. So the demonstration fell somewhat flat, and I then returned to New Zealand and back to the Princess Margaret Hospital.